Hi, my name is Shaylee Marshall, and today I'm going to be performing a psychosocial assessment on my patient. Before I begin, I'm going to perform all my general principles and safety practices. I'm then going to knock and enter my patient's room, provide for privacy, perform my hand hygiene, and introduce myself to the patient and have them identify themselves using two patient identifiers. Can you please tell me your name and date of birth?
Destiny Sowers, 7/27/005.
Okay, and then I'm just going to check their bracelet to make sure that matches. I'm then going to make sure that I establish a rapport with my patient. And do you know why you're being seen today?
Yeah.
Okay. And then I'm going to review their physical status and health history and grab some vital signs as a baseline. Do you have any thoughts of harming yourself?
No.
Have any thoughts of harming others?
Nope.
Have you ever thought about harming others?
Nope.
Okay. Do you have any concerns for your safety?
Nope.
Okay. Then I'm going to look at her appearance, see how she's groomed and dressed. She seems to have good hygiene and she's maintaining eye contact with me. She doesn't have any skin marks. Her posture and body language are good. Then I'm going to look at her affect and mood. She doesn't seem to be angry or withdrawn. She's acting appropriately to the situation. I'm also going to look at her mood to make sure she's not anxious, fearful, or sad or anything like that. Then I'm going to look at her behavior and motor activity to assess to see if she's pacing or if she's restless, combative, make sure her gait's all good and well balanced. And then her speech, look at the rate, volume, and see if it's rapid, slow, normal. The volume of her voice is good. She's not slurring or stuttering her speech. She is alert and oriented, so her thought process is not disorganized. Are you having any hallucinations?
No.
Okay, she's not having any hallucinations. Do you know where you're at?
Yeah.
Okay. Do you know what the year is?
It's 2025.
Okay, and do you know the current president?
Trump.
Okay. Her cognition's good. She's alert and oriented. Her memory's good. Do you take any medications?
Mm-hmm.
Yeah, can you name those for me?
Just paroxetine, calcitrol, cetirizine, and vitamin D.
Okay. Do you know how much of those you take?
I can't remember the exact amount, but I do remember the paroxetine's 20 milligrams.
Okay. How often do you take those?
I take each one of those every night.
Okay. Do you take any herbal or over-the-counter drugs?
Only ibuprofen or acetaminophen.
Okay. Do you know what milligram those are?
Usually I think 200 milligrams each.
Okay. How often do you take those?
Only as needed.
Okay. Do you drink any alcohol?
Nope.
Okay. Do you do any recreational drugs?
Nope.
Okay. How's your family support?
It's pretty good.
Okay.
Yeah.
How about your friends?
It's very good. Yeah.
Okay. Are you sexually active?
Nope.
Okay. If she was sexually active, I'd ask her if she practices safe sex or practices birth control. Who do you depend on to give you support when you need it?
My family and my best friend.
Okay. Tell me about where you live. Where are you from?
I'm from Lake County, Kentucky. Pretty country area.
Okay. What do you do in your free time?
I'm at school or work, but when I'm not, I'm usually helping around on the farm, fishing, hunting, playing games.
Okay. So that's included in your hobbies and sports?
Yeah.
Yes.
And my sports, I like softball.
Okay. What gives you pleasure?
Spending time with my family.
Nice. So when you're having a hard time, what do you do when you're upset? Sleep.
I sleep, yeah. I sleep for a lot of different situations.
All right. And what helps relieve that stress?
Sleep or crying.
Okay. Do you have any spiritual, religious, or cultural practices that we need to consider in the care that we give you here?
Nope.
Okay. So there's not any restrictions on your diet or medical interventions?
No, I'm a Christian, but there's no restrictions on any diets or anything, or medications.
Okay. All right, and that completes my psychosocial assessment. At the end of this skill, I would perform my hand hygiene and document and record.